our YouTube channel. Today we're going to be talking about what you need to know when you go into the OR for the first time. So we have about 10 tips that we'll be sharing with you. The first thing is be there early.
I think the most important thing is going there early. You want to know where the OR is and which particular OR is the surgery being done. You also want to go there early so you can know what cases are being done and kind of quickly go through your phone to get an idea of what questions you might be asked.
Exactly. So what we were used to do is when we had a case early in the morning, we'd get there about 20 to 25 minutes early, get familiar with everything, read up on the cases so that we can answer any questions that they may ask us during the procedure, and we would shine like stars because we knew exactly what they were going to ask us, or at least we tried to.
Right. Then the second tip is knowing where the locker room is, because this is where usually the surgery scrubs are. Um, this is where you also find the shoe covers and the hair cover, as well as the mask. You want to put all these on before you go in the OR.
Actually, the masks are usually right before you enter the OR. Yeah, you can find the shoe covers and the hair covers either in the locker room or right outside of the locker room, but it depends on location. And like he said, you have to make sure you put on the mask before you enter any OR. If you don't, they'll kick you out.
Alright, so now we're finally ready for our primary scrub.
Exactly. So what's the primary scrub? It's basically you're washing your hands very thoroughly from the tip of your fingers all the way to your elbows, and you want to make sure you scrub underneath your nails and clean up your hands really well.
Clean in between the webs of your fingers all the way up to your elbows.
Very good. And basically what I would do is I would just grab a paper towel, dry off my hands, so that way I have my primary scrub done, and now I can go into the OR, help out, assist with the nurses or anything, and then whenever I'm ready to actually put on my gown and gloves, I'll just use AvaGuard and be ready.
Right. So now you're finally ready to enter the OR. So going in there, you want to make sure the first thing you do is you want to introduce yourself, because sometimes it's a little awkward when you just walk in and everybody looks at you. So you want to act a little confident, and you want to introduce yourself to the surgical tech as well as the circulating nurse.
And anyone else who's in the OR. If there's a anesthesiologist or a CRNA, you want to make sure you introduce yourself. It's polite, and if you do introduce yourself, they'll be nice and they'll let you do things like intubate. I got to intubate a bunch of patients, and or administering medications to sedate the patient, or even to put in Foley catheters, or when the nurses are prepping the patient, you can ask to prep. They'll let you do that if you're eager enough. Or like I said, putting in Foley catheters. It's cool. Why not? You're helpful and you don't get in their way. And if you're eager to learn, they'll teach you.
So most students know their glove size because they've been told so by their school, and they've had a chance to put on some gloves in their school. But for the most part, the average size is about 7. For girls, it tends to be 6.5, and most guys wear 7.5. If you don't know the size, you can usually ask the surgical tech, and they can fit you one and see which one fits your hands best.
Exactly, or the nurse. Usually the nurses are super nice. You tell them, hey, I can't remember my sterile glove size, and they'll help you get fit into ones. I remember I always used to wear a size too small because I didn't know, so I would always wear 6.5, but I have chubby, manly hands. So I learned that a 7 actually fits me better, and I'm able to manipulate things and hold the retractors much easily rather than being wearing a 6.5 and can't
Right.
move my fingers.
All right. So now you want to make sure you grab some pairs of gloves before you go in the room. There's two kinds. There's an indicator, which tends to be green, which goes in the bottom, and then an outer pair, which goes on top,
Yeah.
which is usually clear.
Exactly. So, what I usually do is I wear 2 pairs of gloves just because sometimes you don't know. Some patients may have Hep C, or you just want to be careful. So, it's easier to just have 2 pairs of gloves. So, if you do contaminate yourself, you can just take off your outer layer and you're fine. So, you grab your gloves and your gown.
So when opening the gown, you want to make sure that you're opening it away from your body. You
Mhm.
don't want it to touch you. So you open the two sides, the back, the one closest to you, and then one that's away from you, and then you place the content of it on the sterile table.
Exactly. So if you don't know how to open up a gown or how to open up your gloves properly, you can ask the nurse. They'll show you, or the surgical tech. And Basically, the most important thing is you don't want to contaminate any of the sterile field. You just have to be very cognizant of your surroundings, and make sure you, when you place something sterile on the sterile field, you do it in a proper manner.
Yeah, the trick is to never turn your back to the sterile field because your back is obviously not sterile. You want to make sure you're not bumping into stuff or bumping into people.
Mhm.
Just don't be clumsy.
Exactly. So let's say you've done all of this, you've introduced yourself, you've helped out the nurses, got the patients ready, and they say the surgeon's about to be on his way. Now, you don't have to go back and do the scrub all over again because you already did your primary scrub, so your hands are clean. So then what you can do is what?
You want to use Avogard. You don't have to wash your hands all over again.
Exactly. So for
Mhm.
Avogard, you do the 3 pumps. So once you have had the Avogard, then you can go into the OR.
And then once going in there, you want to keep your hands to your chest level. You don't want to drop it down because then obviously it's not sterile again. You have to go back and use the Avogard.
And then the surgical tech will help you put on your sterile gown, and somebody's going to come behind you and tie your gown, and then the surgical tech is also going to help you with your gloves. But let's say if the surgical tech is busy, you should be able to gown and glove yourself. They're not going to expect you to do that your first time, but you can definitely learn. You can watch others and learn how to, or at least practice to gown and glove yourself if you're in that situation.
All right. And finally, you want to be honest. If you ever do break the sterile field, you want to let one of the nurses know that that has been done so, and you go back out and use Avogard to clean your hands and arms, and then re-gown yourself or have one of the surgical techs or nurses help you.
Also, you have to know how to hold a scalpel. You hold it like a pen. The bovie, sometimes they'll let you cauterize things. So you basically you hold the bovie just like a pen, and there are two little buttons on the bovie.
There's a yellow, which is usually for cutting, and there's a blue one, which is for cauterizing and burning. The best way to remember this is the blue one is for cauterization. Cauterization, in other words, would be burning, so B for B, so
B
that way you
for
won't
B,
forget it.
B for burning.
Right. And then lastly, as a medical student, your job usually entails helping out the surgeon, so sometimes you might need to do some retractions, so always be ready for that. Also, when the surgeon is suturing, if you're not doing the suturing yourself, always have a pair of scissors in your hand and be ready to cut because obviously the surgeon wants to get out there as fast as they can. It's always good manners to be ready and cut as soon as the suture is tied.
And a few other things that you should know is how to suture. Practice suturing. I practiced on bananas, oranges, anything you can get your hands on, or even get those sterile blue towels and get any suturing material and just suture those so you can practice your suturing. My favorite one is the subcuticular, the one that plastic surgeons do. That's definitely one of my favorite suturing.
I think one of the most important suturing techniques to know is bearing the knot.
Uh-huh.
That's really important because a lot of times that's all they use in surgery.
Yeah.
As well as knowing how to do hand ties.
Surgery is actually really fun, and you just have to let yourself enjoy it and go in with an open mind. And it's really fun being around surgeons, and
Mhm.
sometimes it's a little daunting when you go in for the first time, but once you get accustomed to everything, once you know what is expected of you, it's
Mhm.
very enjoyable.
That's all the tips we have for you guys.
So thank you for tuning in. Make sure to subscribe to our channel, and stay tuned for more great videos.